If you don't do a laser, the chance is only 30%. What do you think? He says, well, I will not do laser. Thank you very much, goodbye. I want to do a laser, sign. You sign, it's over. But this doesn't mean that he signed, that you go and hit his macula with laser. If you do anything wrong, you have to be asked for it. The other thing in endocrine disease is thyroid eye disease, TED, thyroid eye disease, or what we call thyroid ophthalmopathy, or what we call thyroid orbitopathy. Now, patients having thyroid problems can have problems in their eyes, which can occur even before they know that they have a thyroid problem. You can look at the fundus of a patient and see a diabetic retinopathy, and the patient doesn't know he's diabetic. So ophthalmologists, most of the time, they diagnose these patients before endocrinologists. This is the beauty of it. The same thing here. Somebody comes to you with an eye which is gumming out. What we call proptosis, بحوز الجاحظ. بتاع زمان عنده كتاب الجاحظ. كان عنده proptosis. ها؟ ما كانش عندهم دكاتره الدم بقى يشخصوه. هو زي الثيرويد كيس. شوفوا ازاي؟ زي موناليزا بالظبط. موناليزا كان عندها كاليزيون لو بصيتوا صورتها. If you see Mona Lisa, she has a كاليزيون جوه الليبل الليفت اي. بتتباع ب $50 مليون وهي عندها كاليزيون، شفت ازاي؟ واحنا لو بعنا نفسنا كلنا كده بنمشي مثلا 10 جنيه. يعني thyroid eye disease. What happens in these patients is that there is a problem, an antigen-antibody problem. There is an autoimmune problem in these patients. An autoimmune problem which causes inflammation and infiltration in the extraocular muscles and the orbit. Infiltration by plasma cells, by macrophages, and there is something called glycosaminoglycans. أخدتوها في البايو؟ قلت لك على طول ده حاجة كويسة قوي يعني الضغط الكتير ده بيريح الواحد ها؟ Did you hear about glycosaminoglycans? Biochemistry? ثانية سوري. ثانية. ضروري في البايو؟ أخدتوه؟ glycosaminoglycans. أخدتوه؟ There is increased production of glycosaminoglycans in the orbit and the extraocular muscles. فتلاقي اوضه كده زياده تاخد 10 تنفار بنحط فيها 150 نفر، ايه اللي هيحصل في الناس؟ هيطلعوا بره البلد. This is what happens with the orbit. The orbital volume increases behind the eye. What will happen to the eye? It will pop out, what is known as proptosis. And the great thing here is that it's not a must that the patient be hyperthyroid. مش شرط. It's an antigen-antibody reaction. Has nothing to do with the thyroid status. So even if the patient is normal, is euthyroid, EU, يعني normal thyroid function, he can have proptosis. مش شرط انك تشوف عنده واحد عنده proptosis يبقى ده عنده thyrotoxicosis. It has nothing to do with the T3, T4 levels in the blood. We take this in internal medicine. Now these are patients here with thyroid eye disease. This is what? This is the conjunctiva, which is swollen and edematous, what we call chemosis. Why is it swollen? Because the conjunctival circulation, which is going backwards to be drained, is strangulated by the increased orbital pressure. And of course you can see the eye, which is a big popping here. This is another patient. You ever saw these patients? Patients with having a steady look, مبحلقين. You took the lid, right? Lids normally cover 2 millimeters or 1/6 of the limbal circumference. Here, the lid is at the limbal circumference. So this is what we call lid retraction. Why is he having a lid retraction in these thyroid cases? Why do they have a lid retraction in thyroid cases? A sympathetic hyperactivity. So what?
Where's muscle?
Affects which muscle? Which takes from the sympathetic system. Miller's muscle. Miller's. Have to be levator and something coming from the back of the levator, which is called Miller, which inserts at the upper border of the tarsus. You took this as the lid. So Millers are very active. very hyperactive. So what happens is that you get this lid retraction. And this is the first time when you see somebody having this, there are a lot of causes for lid retraction. Some of them are related to tumors in the big brain. So don't always stick it to thyroid. Be wise enough to order a CT always. This is another case. See the lid retraction when there is a lot of sclera here. This is another fellow. What is this? Now I'll ask if this is a lid retraction of the right eye or causes of the left eye. Anything you heard about what is known as Hering's law? Hering's law, physiology, first year. Hering's law of equal innervation. You took it in physiology. Herring. هيرنج يعني السمك المدخن ده، بس هو راجل كان اسمه جون هيرنج يعني جاب كده يعني. Herring, what did he say, Herring? He said that if the brain sends one impulse to one muscle, he sends an equal impulse to the other agonist muscle. بمعنى لو انت هتبص لفوق, the brain sends one impulse to the elevated right eye and sends one impulse to the elevated left eye. So they work in tandem, in harmony. مفيش حد يطلع فوق تاني. This is Herring's law. Okay. I will say that this patient has a lid retraction of the right eye. So the brain knows that this levator is working more than it should.